Welcome again to another lecture. This is Methods of Tertiary Prevention from the Jekyll textbook on epidemiology, biostatistics, preventive medicine, and public health. This chapter is part of section 3 in the Jekyll textbook that focuses on preventive medicine and public health. So what is tertiary prevention? If you remember our model or our stages or phases of disease, that tertiary prevention falls under treating something that is symptomatic. So stopping, slowing, or reversing progression of a symptomatic disease to limit disability or dysfunction. There's two types of tertiary prevention that we want to consider when we are providing tertiary care. That includes disability limitation as well as rehabilitation. So disability limitation would be tertiary prevention that is preventing any further impairment. For example, this could be trying to slow down the effects of diabetic retinopathy in the eye, for example. Rehabilitation. So in tertiary prevention, we might need to conduct rehabilitation by reducing social disability at given levels of impairment. We can also strengthen remaining functioning as well as learning to function in alternative ways. So traditionally rehabilitation, we think of orthopedic rehabilitation or physical medicine rehabilitation, where somebody has received some kind of injury to their musculoskeletal system, rendering them with a paralysis, for example. And so therefore, you have to reduce certain kinds of social disability. You might have to strengthen functions that are still there so that they can be more, they can be as productive as before, but still with this disability. And then learning to function in different ways. So if a patient has a paralysis, they might need to be on a wheelchair, for example. Other definitions to consider. I know that as healthcare professionals, you're already familiar with many of these, but just to recapitulate. So disease is obviously the medical condition or the diagnosis. For example, I mentioned diabetic retinopathy. So that would be a diagnosis with somebody who has diabetes, who also has diabetes that has infected the eye, and therefore they are having ocular issues with respect as a result of being diabetes, and for the diabetes and the vascularization, right? So if you've studied diabetes already or diabetic retinopathy, you know that one of the problems in this particular disease is that the vascularization or angiogenesis of blood vessels are occurring in diabetic retinopathy. Disability, we mentioned that word in the last slide, but an adverse effect of a disease on objective physical, psychological, and social functioning. So disability is not just physical, but it's also psychological as well as social. So if we think about psychological and psychiatric care, it's going to be very important for those who, especially who have been in some kind of emotional, physical trauma, mental trauma, and somebody who might be diagnosed with, for example, post-traumatic stress disorder. Illness, this is, whereas disability is something that's objective, something that can be possibly be measured and directly observed. Illness sometimes is very subjective, and it depends on the person's perception and feelings. So this illness is the adverse effect of the disease or disability on how the patient feels. This can be powerfully influenced by the patient's perception of the disease. So for example, maybe there's a stigma behind a disease like depression, disease severity, patient's expectations for full recovery. Those are things that will change the perception of a patient with respect to that disease. So definitely have to address all of these components for an effective therapy when considering a symptomatic disease and you're going to utilize a form of tertiary prevention. What are the considerations? Well, by now in your healthcare training, we know that when something is symptomatic, uh, something that is symptomatic can be very dangerous from a pain standpoint. It can be very dangerous from a mortality standpoint. Some certain things can kill you, whether it's very overt or covert. And so we basically have two, especially with respect to pharmacy and medicine, uh, especially with chronic diseases like diabetes. We can treat a patient medically, pharmaceutically at first, and then hopefully it doesn't lead to surgical uh, a surgical approach to the problem, but things can progress even in diabetes. Somebody who has uh, diabetes and who has diabetic retinopathy, which we mentioned earlier, if diabetes isn't treated, the diabetes can cause blindness, and that could certainly require surgical ocular procedures, as well as other organ systems as well. Even as you know that diabetes can also affect the nervous system in terms of diabetic nephropathy. Uh, I'm sorry, there is a diabetic nephropathy, but that's diabetes that affects obviously the kidneys. What I'm trying to say is diabetes can also impact the nervous system, where it can diminish the sensitivity of nerves and kill nerves. And as you know, one of the tests for diabetic foot is to test for people's sensitivity um, to touch in their foot, so as to make sure that proper circulation is getting to certain parts of their body. And so that might require a problem like diabetes can require surgical procedures, and that is a form of tertiary prevention. Well, what are all these illnesses and symptoms? Well, these uh, fortunately can be positive in a sense that they are teachable moments. So that a teachable moment is when patients recognize their previously asymptomatic disease and may be bothered enough to want to do something about it. Uh, Sometimes we have to hit rock bottom, as they say, before somebody makes some kind of serious change. What's the relationship between diseases? So we've talked about primary, secondary, and tertiary prevention. Well, there's going to be some relationships between these, right? It's only natural because it's a progression within a linear spectrum. So in tertiary prevention, in an individual, whether you're treating an infectious disease, some kind of substance abuse issue like alcoholism, uh, to that individual, it's tertiary. But to the individual's context, it could be a primary prevention. So when we talk about infectious disease, we might be treating somebody for an STD, for example, that person is receiving tertiary prevention. But also, it's a primary prevention to prevent the individual's contacts from being infected as well. The second bullet point talks about tertiary prevention can be also primary and secondary all at the same time. So the example is when you're managing risk factors that promote the disease progression, often the same risk factors that lead to the disease in the first place, that you're doing all three at the same time. You're trying to control the disease, the tertiary prevention, but at the same time, you might be doing health promotion activities. So you're doing primary prevention, and who knows? There's also ways that that particular person might become screened at the same time for other risk factors, so that you are doing again all these activities all at the same time to a particular individual. We mentioned that word risk factor quite a bit. Risk factors, there's both kind of positive risk factors and negative risk factors, but in a sense, just by the word itself, risk factor kind of connotes something that's negative, such as diabetes. It's like a disease. Diabetes, hypertension, dyslipidemia. These are often called diseases in and of themselves, but they're also risk factors for other diseases. But you can imagine that there are also the positive risk factors are something that we call protective factors. Well, what are protective factors? We can consider some things that we've already mentioned with respect to health promotion. That would be things like healthy lifestyle with respect to nutrition as well as physical activity. Those are protective factors. So there's interventions to limit, stop, or reverse the progression of disease. We already know that that's tertiary prevention, and that by addressing these risk factors, they might also forestall the development and the propagation of related diseases. And so we are now doing primary and secondary prevention. So just a lot of words there, but just showing you how primary, secondary, and tertiary are all integrated in this spectrum where you can be doing all at the same time. And finally, the list of summary. So the goal of tertiary prevention is to limit the physical, social consequences. You can even think of the psychological and emotional consequences as well. The two major categories of tertiary prevention include disability limitation and rehabilitation. So those are the two things that you're generally trying to address in tertiary prevention. And then whereas illness and disability describe objective diagnosis and impairments, the word illness also encompasses the patient's perceptions. So perception is kind of a key word with respect to defining illness. Methods of disability limitation include the therapy, which seeks to undo the treat or damage from an existing disease, symptomatic stage prevention, which attempts to halt or limit progression of the disease. Tertiary prevention often overlaps with and can be identical to secondary primary prevention in the form of specific interventions, as we just talked about. Although it might seem that the opportunity for prevention is lost when disease appears or an injury occurs, this is often not the case. So sometimes we do have to hit rock bottom to kind of get on the board with prevention. And then lastly, the appearance of symptoms or the threat of severe complications may lead to patients to take an active interest in their health, which is a good thing, seek healthcare that they need, and make positive changes in their environment, diet, and lifestyle.